Hi, my name is Janelle,
I'm Fiorella.
I'm Ali.
I'm Brianna.
and we're the Diabetes Health Club. Today we're going to be discussing low-income Hispanic families with diabetes in California. And we would like to share our vision of our new idea. So we'd like to propose a new idea particularly for diabetes, and this resource will involve the use of an application where patients will be able to actually use their cellular mobile devices and be able to track their blood sugar levels and access health tips and how to boost their overall health status at their convenience. With technology being the new upcoming resource to improve health, innovative and advanced applications can be an excellent addition to the diabetes community, being that mobile devices are more accessible. To emphasize, managing diabetes or any disease is very expensive in medical costs due to frequently required health services, prescriptions, travel time, as well as different sets based on an individual's needs.
So just a little background information about diabetes. Diabetes is a chronic disease that can affect the body from producing insulin. There are two types of diabetes. There's type 1 and there's type 2. The difference between type 1 and type 2 is that type 1 begins in childhood and is an autoimmune condition. The damaged pancreas cannot produce insulin because it's genetic. Type 2 occurs with adults, but now they're occurring with kids because of their weight. It increases the risk of having heart disease in the near future for them. Hispanics have a 32% uninsured rate, higher than any other ethnic group. This is because of the lack of health care they are given. Hispanics do not qualify for most health care, which makes it difficult for them to receive the correct care that they need. In the year 2010, about 25% of young children in California had diabetes. This is because most children were not health educated on how to prevent from having an unhealthy lifestyle, and the consequences came along with it.
After doing our background research on type 2 diabetes, we started researching current data trends within the United States and specifically within California, because that's where our focus is. Diabetes is the 7th leading cause of death in the United States, and it affects nearly 30 million people that are currently diagnosed and undiagnosed. Specifically within California, over 2.3 million people have been diagnosed with diabetes, and 1.9 of those cases are from type 2 diabetes. In California in 2017, the estimated cost of direct medical expenses for diabetics totaled in over $27 billion. The higher rates of type 2 diabetes are strongly correlated with race, displaying a health disparity in low-income areas. From 1999 to 2010, African Americans and Hispanics almost consistently had rates of diabetes twice that of non-Hispanic whites. Also, obesity is the main contributing factor for individuals to develop type 2 diabetes, and it puts them at a 4 times higher risk than those who are not obese. After looking at this data, it influenced us to become very passionate to help these low-income communities in California in their daily lives to help with those type 2 diabetes.
So the innovation our group would like to propose is an application which can be used on patients' cellular devices to view their blood sugar levels. This app would work similar to other health apps on all smartphones where steps, calories, and heart rate is measured and displayed. Our innovation would be offered for free to all who qualify for Obamacare, being that our priority population is low-income patients. We would have patients plug in a blood testing square into the charging port of their cellular devices that will be able to read their blood sugar levels by having them insert a blood strip. The blood strip would then register and display their results on their cellular device, while also providing health tips depending on their levels. Patients would plug in their blood testing square into the port and would receive recommendations based off of that. The app will also allow patients to create short and long-term goals to improve their overall health, which will be tracked in their health log. Our application can be used globally, being that it will be available in all languages. Additionally, the BSL Reader aims to encourage people to keep track of their levels regularly without having to worry about making sure they have a separate device on them. Most people in today's world have a cell phone, which is why this will succeed in increasing awareness and self-maintenance amongst diabetics. Blood sugar level readers can definitely be pricey, which is why they will be available through Obamacare.
Most importantly, to be able to launch the application, we will need a team of staff. For example, interns, staff employees, directors, and managers will be required for a successful application launch. Therefore, such potential backgrounds that can be beneficial to this application would be assets towards the development of engineers, marketers, and individuals with business or finance skills. Other backgrounds that would benefit the application launch would be information technology and services, health and wellness and fitness. With individuals in these backgrounds assisting with this application launch, the diabetes application can then be able to troubleshoot without any issues and focus on expansion once the innovation does hit the market. As for our resources, we did decide to consider partnering with organizations such as Kaiser Permanente, which has been around for quite some time and is reputable for good services. They are definitely very passionate about providing quality healthcare services for their members. They have served over 12.2 million members over the time that they have been open. Another partnership that we were considering was United Healthcare. They do cover people under the ACA and is dedicated towards improving a diversified healthcare system for all. Therefore, these healthcare partners can definitely help decrease low-income families with type 2 diabetes across California.
We're standing here before you today in hopes of receiving the $1 million grant to fund our diabetes blood strip tester innovation, and would use it to operationalize the plans to provide low-income citizens in California with affordable and easy transportable technology to help their blood sugar levels and test their sugars and facts and information to help them on the go. Initially, these funds are going to go towards engineering the app and the device that would connect to the individual's phone to display their blood sugar. The people hired to build the app and device would be paid at a fixed rate to ensure that we can fit that into our budget. Also, the cost of production for the device and supplies are included. The device would be made at a cost-effective way so that we can ensure that it's set at a reasonably low price to be more affordable for these low-income families and for others as well, not just low-income, even though that's our main target. We will also be having paid advertisements displayed on billboards in drugstores or above freeways and such in low-income areas, in hospitals with high rates of clients utilizing the Affordable Care Act, hospitals that like all Kaiser hospitals or hospitals that take United Healthcare insurance, and online to pop up in recent, one of the top choices for blood sugar monitors when one searches that. We would also hire an outreach team to go out into these low-income income communities and talk to them about the app and device on a more personable level. By talking to these communities one-on-one, they would go to centers, schools, and other free places so that they get a better understanding of what the app is and ensure them that it is affordable. And these places that they would be speaking at would not cost us anything, but the outreach team would be paid at a fixed rate. This grant would be really beneficial in launching our health innovation, and we hope you consider our team when awarding it to someone.
So in conclusion, We believe that diabetes can be preventable to low-income families, but because of the lack of health care being provided to them, it makes it harder for them to receive the correct care that they need. Our innovation of the blood sugar reader can be a way to help keep track of their sugar levels at all times. Having diabetes is the 7th leading cause of death, which is quite alarming, especially for specific ethnic groups. Partnering up and receiving the correct resources from Kaiser Permanente and United Healthcare is extremely helpful because they can also provide other resources that we, if in case our innovation does or does not work for them. It will allow excellent quality services on how to work diligently with people who only have ACA healthcare. Using huge resources and this innovation to our patients with diabetes will be a way to improve quality care and in providing healthy tips for them. So that pretty much concludes our presentation on diabetes and the innovation that we want to fund. So hopefully you can.